The Mako robotic arm is a innovative way to perform our total knee and total hip replacement surgeries. We have had a lot of different technological advancements in terms of how to perform the surgery in the last several years, but this has been, for me, a game changer in terms of how we do the surgery. What we do with Mako is there's a preoperative step that we have to do first, which is get a CT scan of the patient's knee or the hip. And what that does is it provides a very accurate bony landmarks, way to preoperative plan, the most accurate way, individualized to each patient. We could almost do a virtual surgery in a way before we actually make the bone cuts. So we'd have to keep recutting. So those are the benefits. What the Mako provides is that we could do this all beforehand. We could plan way ahead of time, and during surgery make little bits of changes very accurately before we even start the surgery. And so I think reproducibility, accuracy, and I think that will translate to actual functional outcome scores. It's more of a soft tissue friendly surgery now, and so that will definitely translate to less pain, less swelling. I believe that the patients will feel that their knee feels more natural earlier. In addition to the accuracy of the surgeries, will definitely make the recovery a little bit faster as well. Mako is not the only thing that we offer that's innovative and I think unique to the Bay Area, but I think this speaks to the overall program we have here at Camino, where we started an anterior approach total hip replacement very early on in the adaptation stage, when only a few percent of the total U.S. Joint replacement surgeons were performing these surgeries, and now more than 20% is doing it. And so I think this is, speaks to the whole Silicon Valley environment, that we pick and choose the technologies that's out there very carefully, but we adapt them very quickly for the patients. And I think this just speaks to that. And this is something that is not going to finish here. We're going to keep making advancements and improvements for patient care.